So today we're talking about lordosis, which is excessive curvature in the lower back, which is very common after pregnancy. Now think about it, when we're pregnant, we're often standing like this, we got a big belly pulling us forward, and our back just becomes conditioned to that, so this starts to feel normal. Sometimes after pregnancy, people can maintain that posture if they don't work to correct it and to build the muscles of the core and glutes to help support that. Today we're going to look at how to identify lordosis and anterior pelvic tilt, what causes that, and some exercises you can do to help. So the first thing I want you to do is to stand in the mirror and take a look at your self-profile view. I want you to just stand normally the way you would, just not paying attention to your posture. Now, if you have your knees bent, you'll notice that it's probably going to put you into a bit of a posterior tilt. So that's when we're slouching with our shoulders, our knees are a little bit bent, and we're not really engaging the core to hold us up. Now, if you're standing with your booty out, you'll notice that your rib cage may be flaring, the muscles of the hamstrings are not working at all, and you might have tightness in your low back or your hip flexors. Now, ultimately, we want to be in a neutral spine position. So if you put your hands on your hip bone, so I have my fingers down near my pelvis bone and the palms of my hands on the top of my hip bones, I'm going to look at where my hands lie. So right now, my hands are fairly up and down. I'm standing in neutral spine. My pelvis is not excessively tipped forward or posterior tipped back. You'll notice to do that, I'm kind of clenching my glutes. So that's a whole other host of issues that I'll talk about in another video. But today we're going to focus on that anterior tilt. So that's when the tops of your hands are more forward than your fingers that are down by your pelvic area. Now, this can cause a host of issues. It can cause low back pain. It can cause your diastasis to get worse or to not improve. Now, I'm going to be talking about one of my clients and what we're doing with her to help fix that, because no matter how many exercises she does, if she's continuing to work them in this anterior pelvic tilt pattern, she's not going to properly address the muscles and really work to help pull those muscles back together. So the first thing I want you to do is to find neutral spine so you can feel what that looks like. So when I'm standing here, do a couple pelvic tilts. So we're arching through our back and then we're tilting forward. We're arching and tilting. Now, after you do that a few times, I want you to kind of find somewhere in the middle. Now you'll notice when I'm in neutral pelvic alignment here, my abs are easily engaged. I'm not having to work to help lift my lower back abs up and in. My rib cage is not flared out. I feel like I can breathe better. I can breathe out of my rib cage because it's not already overextended. I also have good alignment in my shoulders. So I don't have my shoulders hunched forward like this, and I'm not jutting my chin forward into that forward head posture. So when we start with the pelvis, everything up the chain works a lot better. So when it comes to mobility, I want you to try these exercises before your warm-up. So you're going to do these before your core exercises. This is not just going to help bring awareness to proper alignment and core engagement, but it's also going to help loosen up the muscles of the low back to give you a little bit more movement and a little bit more flexibility there. So our first exercise are exactly what we did when we were assessing our posture, but now we're going to do it as a movement. So putting your hands on your hips, I want you to rock into anterior tilt and then tuck under into posterior tilt. Once again, we're elongating through those hamstrings and then we're pulling our hips right underneath us. You want to feel like this is a scooping motion, like we're scooping our pelvic bone forward. And you're going to go through this maybe 8 or 10 times until you feel like you're starting to get some mobility. You will notice one way is probably much easier than the other. I have a very hard time kind of going into that anterior tilt, but posterior feels great. Now another way you can do this is by sitting on a ball. So grabbing a yoga ball, you want to sit on the edge of a ball. So you want to have your knees at about 90 degrees, slightly leaning forward. So right now, in order to stay balanced, I'm in neutral pelvis position. My hips are straight up and down, I'm not arching through my back, and I can feel my core working to keep me in this position. From here, you just want to do that tilt forward And then same thing, scoop that tailbone under, tilting back, tilting forward, and then tilting back. This may be more challenging, especially if you were using your knees to compensate. So I find a lot of people bend their knees in order to get them into that tilting position. So once again, we're taking that out of it and just working on that articulation of the low spine and the vertebrae. Now this exercise is hard to demonstrate because it's such a subtle little change of energy. So we're going to stand with our feet hip width apart, and I want your toes pointing completely forward here. Now, as we stand here, I want you to think about grounding down into the ground. So we're going to be pushing into all four corners of our feet. Now, I'm not rocking into my toes, I'm not leaning back on my heels, but I'm pushing into all four corners, trying to get my pinky toes on the ground, keep my heels on the ground, and ground through the bottom of your big toe. Now you'll notice as soon as you do this, you feel your glutes activate. I'm lifting up a little through my hamstrings and I'm lifting up through my low abs, which is gonna bring me into that beautiful posture. Now, I can already feel those muscles starting to do a lot of work here, but I want you to think about that position when we do some of our other strength exercises, especially when we're lifting things overhead. You want to really feel like you're grounding into the ground so that you're able to engage your core, which is going to support you as we lift heavier and heavier weight. So our next mobility exercise here is we're working on maintaining that neutral posture while we're lifting something overhead. So same thing that we talked about before, you want to start by grounding those feet. So you notice that I'm not locking out my knees. As soon as I lock my knees out, it puts me in a terrible pelvis position here. So little soft bend in my knees, I'm pushing into the floor, and I'm gonna hold this bar, pretending that this is a lot of weight, okay? So grounding into the floor, you automatically wanna lift up and in through that core. Now from here, I'm gonna push up overhead, big stretch through the chest, and bring it back down. So this is something, when you do this, and I'll do this from the side, you'll notice that I'm able to maintain that neutral pelvis. I'm keeping my core drawn in and I'm not locking out through my hamstrings. As soon as you lock anything out, those muscles are not working very well. So once again, I want you to just lift up and down. You can use a broomstick or whatever you have at home. And we're gonna go through this about 10 times, just getting some mobility through the shoulders, working on keeping that core engagement and not letting the rib cage flare out as we reach to the top. Now this next warm-up exercise is called 360 breathing. What is that? We want to think about when we breathe, a lot of people are breathing through their upper chest muscles, which means they're not using their diaphragm and they're not getting any lateral expansion through their rib cage. This can be a big problem during pregnancy and often leads to increased loading through that midline, which can cause that diastasis or make it far worse or harder to repair afterwards. So if you work on your 360 breathing, not just during pregnancy, but also after, it's gonna really help get some rib cage mobility and help you with your breathing when you're under load and lifting heavier weights. So in order to do this, you're gonna put your hands right around your rib cage. So you'll notice I put my thumbs in the back, my fingers are here. I wanna think like my fingers are right along my ribs. Now from here, I'm gonna breathe out. So as I breathe, the way most people breathe, and you'll see this, is they breathe out through their belly. So that's me breathing out, putting total pressure on that midline there. Now, if I use my 360 breathing pattern, I'm breathing down into my pelvic floor, out through my rib cage, and also breathing into my back. So same thing, I'm trying to get some expansion through the rib cage in my mid back there. So I want you to take a deep breath in, and then as we breathe out, you want to think about knitting the rib cage together. So you'll see your fingers getting closer together. You can visualize those muscles underneath, making that movement so that we're bringing everything nice and tight so you can brace yourself during exercise. So once again, if I'm here, my 360 breathing, I'm going to breathe out and then bring it in. Now I'm lifting up through those lower TAs. We have our upper TA, so that's like your rib cage, making sure you're getting your rib cage knit together. But we also need to focus on those lower TAs, so bringing everything up and in so that we get full connection through the entire portion of our core. Okay, bringing it down to the ground for you guys. So I'm gonna demonstrate the hip flexor stretch. So like I mentioned, if your hip flexors are tight, it can cause either one pelvic bone or both pelvic bones to tip forward, leading to that lordosis and curve back. Now for our hip flexor stretch, really simple. We're coming into a kneeling position and we're just gonna lean forward. So as soon as I lean forward, I start to feel a stretch right here. If you're really tight, you may feel this radiate all the way up into your abs and all the way down your leg. You can just rock back and forth here. Try not to go too deep into the stretch. You only want to go as far as you can, and then hold it in that position for about 30 seconds until it relaxes. There's many reasons that your hip flexors can be tight, and honestly, just stretching them is not going to be the answer, but this is something that we'll talk about in another video. All right, now I'm gonna give you 2 exercises that I want you to do that's really gonna help fix that anterior pelvic tilt. Now, the big thing with this is I want you to take what you're learning in these exercises and carry it over into everything else you do. So you'll notice that if I'm going into a glute bridge and I'm used to being in anterior pelvic tilt, so I'm already arched here, my abs are not working at all. My rib cage is sticking out and my abs are completely lax. Like I can stick my fingers in there and they're super soft. Now, if I try to do a bridge from here, I'm not really getting the glute engagement that I want. I'm really just kind of lifting up through my quads and pushing through my feet. And from there, I'm not getting the glutes, which is the whole reason that we do these bridges. So what I want you to do, if you find that you are usually in that anterior tilt, is before you start your bridge, we're gonna work on that scooping motion. So we're gonna scoop it down. So I already feel my abs are working really hard here to hold me in that kind of forced posterior tilt. So once again, you may not even be in that much of a posterior tilt, but because you're so used to hanging out here, this is gonna feel very unnatural. But you want to be drawing that in. So like there's somebody just putting a bow right through your body here. Now, hands down by your side, holding that contraction, I want you to lift up through your glutes. So you'll notice when I do this now, I'm not flaring out through my rib cage. I'm not overarching here. Very common in people who do a lot of yoga. They're used to kind of going into a full bridge, which is not great when you're trying to rehab any sort of postpartum issues. So going here, I'm breathing out, using that 360 breathing that we talked about, bringing myself into a little bit of that posterior tilt, and then lifting. You'll notice when you do this, you feel it so much more through the glutes. Like my glutes are really having to fire here. My hamstrings are kicking in. After my glutes are engaged, I'm gonna bring that all the way back down. Now, another way that people generally compensate for this is they let their knees flare out. So they go into their bridge, and in order to hold their core in, their knees go out because they're weak through their adductors. So another thing to pay attention to here, we want our knees to stay directly over our hips. Once again, this is going to keep it really into the glutes instead of bringing in everything else to try to make it easier. Our body always goes for the path of least resistance, so we need to make it that we're working the muscles that we intend to work. So I want you to do about 3 sets of 10 of these. Really focus on that posterior tilt before you start, and then lifting up, squeezing through the glutes, keeping that core engaged. So we're making this both a core and a glute exercise. The second exercise that I want you to practice in order to correct your anterior tilt and use this positioning as you do other exercises is dead bugs. So I know you've probably done dead bugs before or some variation of it. But once again, no matter how many times I tell my clients to keep their core drawn in, to pull their belly button to their spine, a lot of people think they're doing this, but really they're still hanging out in that anterior tilt, which means that your core is not going to be activating as much as it should, and you're gonna keep putting pressure along that midline, which can cause the diastasis to get worse. So what we're gonna do today, we're gonna fake a little bit of neutral spine. So having a towel underneath you gives you some proprioceptive feedback. So it allows you to feel if you're pushing into the ground and not just trying to like lock out and flatten your back, because we don't want to be in like a full posterior tilt here. Okay, so I'm going to take that little towel and I'm going to put it right on the small of my back as I lie down into that dead bug position. Now from here, I can feel that as soon as I engage my core, I'm pushing into that towel, and that brings me into a perfect neutral spine. So this is where we want to start every single exercise. If you are not touching that towel and you're just arching over it, you know that you're not in a proper position. And if you're pushing so hard into it because you're trying to get your back flat on the ground, that's not going to be super effective either. So just maintaining that pressure on the towel, feeling that neutral spine. And with our dead bugs, depending on where you are in your core journey, you can modify this. So our traditional dead bugs, we're starting with our feet at 90 degrees. I'm feeling those abs really kicking in to help support the weight of my legs. I'm using my TA to knit my rib cage together to pull up and in through my lower abs. And I'm bringing my arms right over my head. Now from here, extending one leg out and then back to neutral. Other leg out, back to neutral. Once again, really thinking about that 360 breathing pattern. So you always want to breathe out on the hardest part of the exercise. I'm going to be breathing in here and breathing out, extending out, feeling that movement through my rib cage, maintaining that core contraction the whole time. Now, if this is really hard to do in neutral spine because you have not been practicing this, I want you to do it with your feet just on the ground. So pushing once again, finding that core engagement, bringing yourself into neutral, putting some pressure on that little towel. I want you to just bring one leg up to 90 and then extend it. Oops, I almost just knocked over my lamp. All right, so I want you to bring one leg up to 90 and then just extend it out. So once again, this is like a single leg movement, and you may find that one side is far weaker than the other. So once again, I'm going to do it on this side, bringing that leg up to 90 and using my other foot to support me here and just extending it out. I'm having to feel a little bit of different engagement here through my core, and I'm still really working those muscles. Another variation you can do, just floating the legs, holding them here, extending one arm and bringing it back in. Once again, this can be really hard for people if they're not used to doing these exercises in neutral spine. So I want you to try these 2 exercises, do them every time you work out. It's gonna help you not only bring awareness to your body, but it's gonna allow you to get better posture so that everything else you do, you're actually working the muscles that you intend to. Make sure you give me a message if you have any questions. Other than that, you can do this.